extended spectrum beta-lactamase, also known as ESBL. It's a gram-negative bacteria that produces an enzyme known as beta-lactamase. This enzyme has the ability to break down commonly used antibiotics such as penicillin and cephalosporin, having an effective treatment for this infection. There are at least 200 different types of ESBL enzymes. The main bacterial groups known to produce ESBL are E. coli, Klebsiella pneumoniae, Salmonella enterica, and Neisseria gonorrhea. Some of the symptoms are loss of appetite, blood in the stool, stomach cramps, diarrhea, and fever. The signs are red skin around the site that is infected and fluid coming out of the site. Here is a video explaining how ESBL is resistant to penicillin. Hope you enjoy.
These antibiotics are responsible for the demise of millions of my ancestors by inhibiting the synthesis of the peptidoglycan layer of their cell walls. Growing cells burst without the support of cell walls. You humans thought you were so clever when you discovered your precious penicillin, but now, thanks to some evolutionary pressures and a few cheeky mutations, my fellow bacteria and I are now resistant to the beta-lactam antibiotics that threaten the growth of our culture. The primary military tactic of ESBL is to target the amides and ester bonds of beta-lactam antibiotics and destroying them through hydrolysis. Sometimes our ESBLs change the functional groups of these antibiotics. Adenylyl, phosphoryl, or acetyl groups are added to the periphery of the antibiotic molecule. The chemical substitution inactivates our enemies and renders them useless.
Another strategy used by our ESBLs is to modify the antibiotic target site so the antibiotics will not be able to properly bind to our cell wall.
Patients obtain ESBL by being in contact with dirt or animals who have this bacteria. Also by drinking infected water. This water can be infected by a defecation event of an animal or human. ESBL can be spread by blood drainage, urine, bowel movements, phlegm, and a surface that has been contaminated. People who are at risk to have ESBL are the elderly, people with weak immune systems, chronic illnesses, for example, cancer and diabetes. Also people with current surgery and people with open wounds. The Journal of Travel Medicine states that in the United States, children presented with E. coli were 3.3%. For adults aged less than 64 years old, were 4.5%. And adults over 65 years old were 9.5% in the year 2012. Less than 10% of E. coli and Klebsiella pneumoniae produce ESBL in Canada. In Europe, there are higher rates seen in eastern and southern countries. In Japan, the rates of ESBL producers are around 30% in E. coli and 10% in Klebsiella pneumoniae. Imipenem is a medication that could treat ESBL. The mechanism of action is to inhibit the key enzyme in bacterial wall synthesis. Some side effects are severe stomach ache, diarrhea that could be watery or bloody, loss of appetite, jaundice, seizure, and fever. People who shouldn't take this medication is anyone who's allergic, has epilepsy, meningitis, brain tumor or head injury, and kidney disease. Do not use this medication if it has changed color or has particles in it. Infusion can take 20 to 60 minutes to complete. The recommended dose is 250 mg to 750. Do not skip doses because it can increase the infection and become resistant to medication. Store the medication up to 24 hours and do not freeze. Another medication that helps with ESBL is cefoxitin. The mechanism of action is that it inhibits mucopeptide synthesis in the bacterial cell wall. Some side effects are severe stomach pain, diarrhea that could be watery or bloody, jaundice, unusual bruising and numbness, kidney problems, for example, little to no urination. People who shouldn't take this medication is someone who's allergic to penicillin, have kidney and liver disease, have colitis, diabetes, cancer, or heart failure. This medication is given via IV. Cefoxitin can cause unusual results with lab tests, for example, glucose in the urine. Store this medication at cool room temperature between 36 to 77 degrees. Take the medication out and allow it to reach room temperature before injecting the dose. The recommended dose is 2g over 50 ml. Now we'll be watching a video on how to administer carbapenem. Since ESBL can cause UTIs, it's very important to do a urinary assessment. Ask the patient if they have burning upon urination. Ask if they have frequency and urgency. Also if they have suprapubic pain. Then do a CVA tenderness on the patient. Now we will be watching a CVA tenderness assessment.
Find the last rib posteriorly, and that is the 12th rib. So if you feel in between the ribs, be about right here, and then you're going to find the spine. And underneath the 12th rib and between the spine is that costovertebral angle. And about right here is where your left kidney is located, and over here is where your right kidney is located. So what we're going to do is we're going to take our hand and we're just going to put it over here. We're going to make a fist and we're going to thump our hand, and we're going to ask the patient if they have any pain. Okay, do you have any pain with that? No. Okay, and then we're going to do it to the other side. Do you have any pain? No. Okay, and if they had pain, that would indicate a possible kidney infection.
ESBL patients need to be isolated to prevent the spread of this infection. Therefore, nurses should practice good hygiene before patient contact or environment, before performing aseptic methods, after handling body fluids, and after patient and environment contact. Also, nurses should wear PPE before entering the room to prevent the spread of infections. Here's a video on how to put PPE.
If you'll be wearing a gown, put it on first, followed by your mask or respirator, goggles or face shield, and gloves. Make sure the gown covers all of your outer garments. Pull the sleeves down to your wrists and fasten the Velcro or tie the top string securely at your neck and waist. If the gown is too small, use 2 gowns. Put the first gown on like a coat and tie it in front, and then put the second gown on in the usual way and tie it in back. Then put on a surgical mask or fitted respirator. The type of mask you select and whether fit testing is needed will depend on the type of isolation precautions being observed for your patient. Before using a respirator, medical evaluation and fit testing are required. Your goggles or other eyewear should fit snugly. If you wear prescription glasses, you can use a face shield instead. Apply clean, unpowdered gloves. If you or your patient has a latex allergy, the gloves should also be latex-free. Bring the cuff of each glove over the edge of the gown sleeve. Removal of PPE follows a specific sequence: gloves, eyewear, gown, and finally the mask. Remove your first glove by grasping the cuff and pulling the glove inside out over your hand. Hold this glove in your gloved hand. Then slide the fingers of your other hand under the remaining glove at the level of your wrist. Peel the second glove over the first and discard them in the proper container. Now remove your eyewear, face shield, or goggles. Handle the item by its headband or earpieces and discard it appropriately. Now remove your gown by first untying the neck strings or releasing the Velcro, and then untying the back strings. Allow the gown to fall from your shoulders, touching only the inside. Pull your hands out of the sleeves without touching the outside of the gown. Hold the gown inside at the shoulder seams and fold it inside out into a bundle. Discard it in the trash or linen bag as needed. Your face mask comes off last. If the mask is secured over your ears, remove the elastic and pull the mask away from your face. If the mask ties on, untie first the bottom string and then the top string. Drop the used mask into the trash receptacle.
Do not be this nurse, please. The role of the nurse is the safety of the patient. Therefore, the nurse should make sure the patient with ESBL is in isolation. Also, the nurse should prevent infection, patient to patient, patient to nurse, and also nurse to patient, since it can make ESBL infection get worse or have opportunistic infections. Some of the national patient safety goals that have been observed in the clinical settings are reduce the risk of healthcare-associated infections by having nurses use PPE and educating visitors on how and why to wear PPE with an ESBL patient. Also, the hospital identifies safety risks inherent in its patient population by isolating ESBL patients. Patient population health outcomes that can be possibly affected with improvement goals are met are ESBL patients, the elderly, and the patients with opportunistic infections. As a quick recap, ESBL stands for extended spectrum beta lactamase. It's an enzyme made by bacteria which prevents antibiotics like penicillin to work. ESBL can be contracted in the hospital by having frequent hospitalizations, urinary catheters, and compromised immune system. There are two groups of medication that can treat ESBL. For example, carbapenems and cefamycin. Make sure to use PPE to prevent infections to spread and the correct signs outside the patient's door.